My name is Angela Thomas. I'm here to do a head-to-toe assessment. This is my clientele. I'm going to wash my hands. And could you please tell me your name and your date of birth after I wash my hand and hold your hand?
Yes.
What's your name and date of birth, ma'am?
My name is Jane Doe, birthday March 20th, 1615.
Okay, so I'm inspecting her at present time, and I'm listening to what she's saying. She's oriented and alert times 4. Chicalos come in well. Her vital signs are stable. Blood pressure was 110/60. Her pulse was semi. Her respiration was 16. Her pulse ox 99%. BMI was done. Height and weight was also done on her. Okay? So now I want to show you my instrumentation I'm going to be using for this assessment right here. These are my tools right here. So now, I'm going to be using 4 basic techniques, which will be inspection, palpation, and percussion. Okay? So now we'll start to, let me put this back with inspection. I am looking at her head and her face. I'm looking at her hair. It's not dry. Textures are good. Can you leave your head up straight, please? Thank you. Color is good. I'm going to look around at her head. The symmetry, her face is symmetry, equals in color. Everything seems to be fine normally. Now I'm going to palpate her head, and I am feeling for her scab. There's no nits. It's pink. Feels normal. Bony prominences in her parietal area and behind her ears. And I'm going to palpate her temporal artery. It feels good. And now I'll use my scope to listen to her breathing. And use the bellows scope. Low pulsation. So now, I'm looking at her hair continuously. Her hair is not oily. And her face is symmetry. Eyebrows looks good. Good contour, normal. Now I'm going to inspect for her sinuses. I'm going to percuss her sinus, her frontal sinuses, her maxillary sinuses, and orbital sinuses. Palpate her eye for any lesions or bumps. Seems to be very normal. Okay? Then I'm going to put my hands and touch her submandibular joints and ask her to open and close your mouth. Joints are movable, very prominent, accessible. Okay, thank you very much. Now I'm going to assess the facial muscles, and I'm going to assess for facial trigeminal nerves. And what I want you to do at this time is look at me straight and raise your eyebrows. Good. I want you to puff your mouth. Good. I want you to give me a big broad smile. Good. And I want you to show your teeth real good. Good. Very good. And this is, I'm assessing for the trigeminal nerves at this time. Everything was symmetric and everything moved equally. Another thing I want you to do one more time. Try to open your mouth. Try to close your mouth. Try to open your mouth. Thank you very much. That was done. Okay. If you are having any problem with taste, I will try to identify something sweet by putting something sweet in your mouth, but you're not having any issue because your physical assessment was normally. Your history was normal. No problem. So now I'm going to try to identify your sense of touch. And what I want you to do is close your eyes. Tell me you feel this.
Yes.
Feel that?
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 Yes.
Very good. So now, what I'm going to do now is assess your eyes. I'm looking at your eyes. good symmetry. Pupils looks good. Good. So the eyes are no scaling. Lashes are turned outwards. Okay, now what I'm going to do, I'm going to look at your ocular nerves by telling you to look straight ahead. Cover one of your eyes for me, and I want you to look straight ahead and tell me, look straight at the wall ahead of you. Okay, now, and I want you to remove your hand. Pupils constricted properly. Very good. Now, what I want you to do also, at this time, I'm going to give you the eye chart for you to look at the eye chart and read it for me. Here you go. And I want you to read the largest letter that you can see right here. Put your eye, cover your eyes and go ahead.
NTFLCZ.
Okay, that's good. And that's 20/20 vision. Thank you very much. So, I'm going to look at, close your eyes for me. I'm looking at your eyes for any tremor. There's no tremors at all. So therefore, I'm going to inspect your conjunctiva. I want you to open your eye, look up, nice and pink in the lower lids. Now I want you to look down, nice and pink, your upper lid, and your sclera is clear. Now I'm going to palpate your lacrimal apparatus. No exudate, no tears coming through. Okay, so very good. So now I'm going to look at your. What I want you to do right now is to cover your eyes and look at the wall, straight at the wall, and I want to check for your eye movement. And I want it for extraocular muscles in your eyes. Remove it. Remove your finger from my eyes and it's straight. Now what I want you to do is inspect your corner. So I want you to take your finger, I look at my finger, and I want you to follow my finger. These are the 6 cardinal signs that I'm seeing to look at the gaze. And your gaze are equal and reactive. Thank you very, very much. Okay? So now I want you to look at my finger. Okay? And I want you to tell me if my fingers are going 1, 2, 3, 4, 5. Good. 6. Okay. So what I'm going to do now is to inspect your eyes again, and I want you to look straight at my finger.
Okay.
Straight, because I'm looking at your pupil to make sure that they constrict, focus, and they're equal. Both of them was focused equally and equally together. That's why I was doing this, because I can think of what I was doing. Okay, now, what I want you to do, I'm going to inspect your cornea, and I'm going to get my light. Just look straight. Equal and reactive, that's cranial nerves 2 that I'm looking at right now. So what I'm going to do now is to look at your pupil. So I'm going to turn this light off here, and I want you to close the eye, open your eye. Look at it. Pupils are totally reactive, equal and symmetric. Now I'm going to use an otoscope, and I'm going to examine your eyes to the biggest light. It seems like my light is gone. The brightest light I have. So I'm going to look for light accommodation and structure I'm adjusting it to the highest thing. It seems like my light is not working good. So what I want you to do is keep your head up straight, okay? And I'm going to hold your head, and I'm going to look into your eyes. Straight into your eyes. Looking into your eyes. Oblique angle. Keep still. It's all good. I see red reflection of your pupils. A light glow to your pupil. Keep staying at the red reflection at the time. And your retina, I can see your retina in your eyes. I can see the optic nerves, which is yellowish, orange. I can see your malus. I'm sorry, not the malus. And inspecting your pupils, the nerves, they got artery and the nerves coming together. The physiological, I can see the retina vessels. Very good. And I can see the fundus. And the macula, which should be on the right hand side of your nose. Looks good. Okay. Okay. I will always inspect the macula last, because if I put the eye thing on the macula, what will happen is that you'll have tears coming down if I do that first. That's the last thing I should inspect. Now I'm going to look at your ears. Inspect your outer ears. Inspect your pinna. No exudate. It feels good. Good. Okay. And I want to touch the no tenderness. Okay. I'm going to inspect your ears now. Inspect your ear canal. I'm putting your pinna upward and backwards. Close your eyes. I'm going to do the voice test, and I want you to tell me if you hear what I'm saying. Repeat it after me. Okay, very good. So now I'm going to do the Weber test, and then what I'm going to do with the Weber test is I'm going to go ahead and test for transmission to your hair and your skull. I'm going to use the tuning fork. I'm going to hit this right here, and tell me, can you hear it in both ears? Can you hear it in both ears?
Yeah.
Okay, now I'm going to put tuning fork in the muscle part of your ears. Tell me when you can stop hearing it. Can you hear it? Tell me when it stopped.
Yes, I hear it.
Tell me when it stopped.
Okay.
Okay, I'm going to put it on your article, and you tell me when it stopped.
Okay.
Okay. Bone conduction is, air conduction is longer than bone conduction, and that's the test I was doing, and that was the Weber test, and that was the Weber test, and that was the voice test. Now I'm going to do the Renner test. Okay, and we call that next the AC conduction and AC and CA conduction. Okay, now after we do the Weber test, now I'm going to be assessing your nose and your mouth.
Okay.
Your nose and your mouth. Okay. So now I'm going to look at your nose and your mouth. Just look at me. They're all symmetric. Right? I'm going to palpate for your nose. Feel your tap septum. It feels good. I'll look at your lips. They look equal and symmetrical. What I want you to do is to blow your air up in your nose. No occlusion. You can hear no occlusion. And if you had any problem with your smelling, then I'll ask you to smell it if it's coffee cinnamon, but you didn't have any problem in your health history like that. Then what I'm going to do next is I'm going to look into your nostrils. And I'm going to put your head up forward like that. And I'm going to look into your nostrils right here. And as I'm looking to your nostrils, I can see your, I don't want to put the speculum right into your nostril because your septums are sensitive. So I can see your nasal septums. I can see your turbinates. They look good. They look even. And I can see your, I'll move it downwards, and it looks good. Thank you. And I will do the same thing into the next thing. There's no lesion, and there's no, your mucosa is nice and pink up in there. Your septum is not deviated at all, and you seem like you got good airflow. The terminates are also looking good. They're nice and red. Okay? So that is one thing down right here. This is nice and hot. So I want you to show me your teeth, white. They're nice and evenly distributed. And what I want you to do is to look at your lips. They're evenly distributed again. And what I want you to do is to open your mouth, because this is nice and pink. No lesion. Open it wide so I can inspect it. There's no lesion. It seems like you have all 32 of your teeth. Everything looks normal. And I want you to put out your tongue. Your tongue are equal in midline. Looks smooth. Now let me get my tongue blade so I can look at your tonsils. Open your mouth. Looking at your tonsil, your uvula is midline. And stick your tongue out. Good. The color is good. I'm going to put my thing to stretch your strength. Try to push my toothpick backwards. All good. Do the other side. Good. What I want you to do is to put your mouth, tongue down again. And I'm inspecting the teeth. I already did the teeth, the hard palate. The hard palates look thin, good bony prominences. Your vulva is good. Now look at your tongue. Your dorsal part is nice. Put your tongue out again. It's nice and rough. The dorsal part is midline. Small. Put your tongue up. Nice vesicular. It's with some nice prominent vein. Looks good. The ventral surface looks good. Nice and smooth and pink. Invisible vein. And it looks good. Now, I'm going to look in your mouth. I will have a gauze and look in your mouth. Your cheeks are no lumps, no bruises, no lesion. And look at the same side. No lumps, no bruises, no lesion. And put your tongue out one more time. There's no tremor, and it looks good. Equal in size. Well, the other thing I would have done is use a tongue blade and let her gag, but I don't want her to do the gag reflex, just to see that, to assess her cerebellum and make sure that it's all good. Your tonsils, I did look at your tonsils, and the tonsils were nice and small and worn in good size, okay? Your health assessment showed me that your facial and your glossopharyngeal was also, there's no problem with that, and it all looked good. Now, okay? So if there was a problem with taste, with the taste bud, I would have you go and close your eyes and taste it and tell me what it was, but you didn't have that type of problem at all.
Okay.
Okay? So now, what we're going to do is your neck. So now, I'm going to inspect your neck for any bulging, anything. Just lower your shirt down a little bit for me to see. No, you don't do it. Let me do this because I can unsnap it. And let me unsnap the first one. No masses, no swelling. It looks good. I'm going to palpate the nerves, the neck rather, and for anything, the parietal thing. It looks good right now. I don't see any lesion. What I want you to do, I'm going to assess the spinal accessory nerves. So what I want you to do is Now I'm going to assess you for active range of motion. So I want you to put your head down, put it up. I want you to put it on the side, put it on the other side, and put it backward. Now I'm going to put my hands on your shoulder to expect your spinal accessory nerve, and I want you to stroke your shoulder high and try to resist me. Okay, now I'm going to put my hand on the side of the string, try to resist my hand. I'll put the other side, try to resist it. Good. Everything is equal accessory, and there's no contraction on opposite, and it's very good. Now, what I'm going to do now is assess your lymph nodes. There are 10 lymph nodes that I want to look at, and all of them should be bilateral, palpate, and should be good. The first one I'm going to assess is a preauricular lymph node. The posterior auricular nucleus occipital lymph node feels good. The submental lymph node, I'm looking at the submental lymph node right here. I'm looking at the tonsillectomy lymph node. I'm looking at the superficial. I'm looking at the cervical one over here. I'm looking at the deep clavicular lymph node, the post-clavicular lymph node, and the supraclavicular lymph node. And they all feel good. I didn't feel any lumps. No tenderness. Did you feel any tenderness, any pain?
No.
They were all movable, and those are the lymph nodes that I needed to assess. So now I'm going to look at you for your jugular distension. I want you to move your head over there, and I'm going to look at you. I want you to lay down right here.
On my back?
Yes. Lay down right here, and I'm going to unsnap your thing. And I'm going to look at your neck, and I want you to turn your head that side. I'm inspecting your neck for, can you come and see her neck and look at the jugular thing? On inspiration, you see good palpation, right? Now I want you to sit up for me.
The jugular?
Turn around towards me. I want to check on your trachea. Put your legs away, honey. I want to check your trachea now. No, sit down, sit up like you were sitting before. And I'm going to look at this, look at sternal mass, notch, and go and feel your symmetrical. Feel your trachea. It should be symmetrical. I'm going to feel your thyroid. And I want you to swallow. Good. Put your head up and swallow. Sternobascular feels good. I want you to extend your neck. And feeding your thyroid glands. Now I'm going to palpate. I want you to do, I'm going to go in the back, and I'm going to palpate, and when I tell you to swallow for your thyroid zones, you stay just like that. Okay. And I'm going to palpate. Put your head all up. Drink a little bit of water and swallow. I'll palpate. I feel the thyroid glands. Those were good. Thank you. Now I'm going to listen to your jugular for any fluid. It's fine. I will do it on both sides. I'm going to calculate your carotid artery. I'm going to do one carotid artery at a time. Then I'll do the other one. This will stop any blood flow. Okay? And then, now I'm going to listen to your heart rate. So I need to also take your carotid artery right now. It's good. So now we're going to assess your thorax. I want you to lay down. No lay down yet. We're going to assess the thorax. Okay? So now the thorax is going to be your chest, and I'm going to need to lower your top down now. You can take your hands out. You have a thing on. I want you to lower your hand down. I have to look at you. Turn around. Just stay right here. And turn around and look at your back. Breathe in and out. Inspiration, expiration. Very good. Good. Ratio is good. I don't see anything now. I'm going to inspect your xiphoid process, sinus process. Feel a notch in every one. Even space. Inhale and exhale. Then what I want you to do, I want you to breathe in and out. I'm measuring. Good. Breathe in and out. Good. So, which is nice and dull. Okay, now I'm gonna go and listen to your song with your lungs filled with my stethoscope, and I'm gonna listen to the breathe in and out deeply. Again. Again. I'm auscultating her now. Go ahead. Go ahead. Go ahead. Nice and clear. Symmetry. Deep. Okay. Excellent. I did that auscultation to both location and So now I'm gonna have you lay down. Lay down. Lay down. And I'll have the sheet cover you. When I did your lung feel, I didn't hear any crackles. All your sounds were nice and clear and normal. And if you had any crackles, I would ask you to breathe it in and out again so I can listen to inspiration and expiration and to see if it will just clear up, okay? So now, what I should have done is to see that your breath sounds were equal and the vibration was good. So sit up 1 second. That was my mistake. Sit up 1 second. I'm going to just listen to you. And I want you to say 99 as I'm listening.
99.
Good.
99.
I'm listening to your
99.
vibration sound.
99.
Good.
99.
Good.
99.
Good.
99.
Good.
99.
Very good. All right. Vibration. Sounds were equal. Now, I want you to lay down. Oh, and I did not do the front of your lungs. This is not good. So now I'm going to have to do this like this and listen to your lungs feel from the front. And I want you to turn back around like this. This is a hot mess because I'm rushing for time. Right? So first of all, I will go ahead and palpate any tenderness. And I want you to breathe in and out, my finger. Good. Good. Equal deep breaths. Very good. Symmetry, and it's simultaneously breathing, and you did quite good with that. Accessing muscles are tactile. Then what I'm going to do now is to listen for your vibrations. So 99.
99.
99.
99. 99. 99.
Okay. So, I'm sorry. Now you said 99, 99. So I'm going to do for percussion. The sounds are all dull and all equal. Now I'm listen to your diaphragm. In and out, you sound nice and clear. Breathing is normal. Now I'm going to listen to your tracheal sound. Good. Wall sounds good. Listen to your broncho. Bronchovesicular sounds are good. Very good. Okay. Sounds all good. Now I'm going to listen to cardiac aspects of your lungs, so I want you to lay down now. We're gonna take the top off. And take this down. I'm listening to you. I'm going to forecast for your apical pulse at the 4th interpulsar phase. I can feel it. Okay, good. And then I'm going to forecast for here. Good. Okay, okay. Okay, now I'm going to do the vascular system. I'm going to check your nerve bells with good capillary refill, good range of motion. It's good color. I'm going to sensor your sensory. I'm going to check for your radial pulse. I'm going to check your brachial pulses right here. They're all palpable. I'm going to do the tuning fork to check for your vibration and the bony prominence. Tell me when you start feeling it and when you stop. Tell me when you start feeling sensation.
Stop.
Okay. So now I'm going to go ahead and assess for your motor reflex. I'm going to assess the touch sensation, and I want you to tell me, close your eyes, tell me, what do you feel, sharp or dull?
Dull. Dull. Sharp. Sharp. Sharp.
Okay. Keep your eyes closed. I want you to tell me where I touch you. Tell me where you touch you. Okay, good. That was assessing your motor function and the tender reflexes. That's what I was doing at the time right here. Now, what I'm going to do is to test your reflexes, your biceps, your triceps now. With the tuning, the arm, I'm going to hold the arm like this right here, and I'll hit this right here. Good, jump. And then I want you to do like this, and I check right here. Good. Good reflexes. I like to pull on the extension, and I'm going to do the for your forearm. I'm going to do this 3 center your radial. Good. Perfect. I'm going to finally we're going to do the cerebrum of your to make sure that your palms, by doing this, that it works, the cerebrum works. And what I want you to do is put your hands on your lap and then back and forth fast. Fast, 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 fast. Very good. Good coordination in each finger. Your good hand. And what I want you to do to check your cerebrum also is to touch your finger with all your back and forth. Back and forth. Very good. So now, what I want you to do now, finger gaze localization that we're going to do. I'm going to put my finger here, and I want you to touch your nose. With my finger. Good, good, very good. Now, so I want you to close your eyes and extend your arms like this, and I want you to touch your nose to your arm. Come on, each one. Very good.
Wait,
The
my
next,
nose.
give the other hand. Okay, the other one. Good. Equal spoon and do one at a time and one at a time. Very good. Now we're going to assess your abdomen. Lay down. Right up there. So we're going to put this over you. And we're going to place this up here. And we're going to assess your abdomen. So what I'm going to do first, I'm going to look for symmetry, contour, and breathe in and out, highly movable, and any lesions. I'm not seeing any masses. It all looks good. Then I'm going to check for midline is good. So then now I'm going to listen, palpate all 4 quadrants. For a full minute. Bowels are normal and reactive. Vowel sounds are normal and reactive. I'm going to listen to your utter. Renal artery. Iliac artery on both sides of it. The femoral artery. Neuroi seems to be very normal. Now I want to percuss your abdomen. Dullness sounds like it's good. Now I'm going to percuss for your abdomen, for your liver. Percuss your liver, your gallbladder. Good. Now I'm going to percuss your liver. Nice and dull. Now, vowel sounds are good, equal in all four conjugal. They're very normal, no hyperaction. The airway is good, all the different arteries are good and listens good. So now, what I'm going to do, we're going to sit up now and we're going to do your no tenderness. Did you have any tenderness, any pain when I was doing this percussion?
No.
Could not percuss your gallbladder. And let me, one more part. I did not percuss your spleen. I did not feel for your spleen. Turn on your side for me to feel for your spleen. Just a little on the side. Yeah, that is fine. Okay. Come on out. And I listen to everything, and I listen to you, and think to your thing, and the only thing I didn't do was listen to your percuss your kidney, but you don't have any kidney problems, so that will fine. So now we're going to go down to your legs. I'm going to look at your legs. Your hair are evenly distributed. It looks good. No edema notice. Color is good. Look at your toes. Your toes are looking real good. So the skin color is good. The hair is good. Toes looks good. Temperature. I'm going to assess with temperature. Nice and warm. Good. Now we're going to assess for the notable thing in your knees. Good. Do the same thing here. Good. And then I'm going to ask you to lay down again. And then let me put the covers over. And I'm going to ask you to flex your foot, then your knees. Good. Assessing your motor reflex right here is good. Your foot is good. No tremors. Good. And the same thing that goes here. I'm going to assess for your artery, your fin pop. Bring your knees for me. So now we're checking the Babinsa reflex, the dorsal positive reflex. And, okay, good. It's positive. Come on. Stand up for me. Sit up for me. Now I'm going to take your motor movement. So stand up.
Stand up.
Please. So I want you to close your eyes and walk towards me.
Close my eyes.
Yeah, Turn around and walk back. Good. Okay, I want you to stand up. And then I want you to put your hands out. And okay, good. Equally reactive. I want you to put your feet together and your arms together and stand up straight with your eyes closed again. Okay? Good. So everything is equally good balance. Assessing acoustic nerve, that's what I'm doing. Right now, cerebral function is right and good muscle strength. That's what I just did. Okay, now I want you to walk with your foot straight in front of one in front of the other heel toe. Able to walk straight. Your balance will not move. Moving your balance.